What's up guys, David from OT Focus, and today I'm going to talk to you about why patients in the hospital with cognitive deficits, this is going to be like your patients with dementia, why do they go undiagnosed? I feel like this is kind of a hot topic just because there are so many patients in the hospital who don't get screened for any cognitive deficits. All right, so the first reason why these patients aren't being diagnosed with dementia or cognitive deficits is because 60% of patients in the hospital just don't show these symptoms. So they may have like some cognitive deficit, but they're not like, they're still oriented to time, to place, to location. They know why they're in the hospital, but they may have like something else going on. Maybe they have like mild dementia, and people aren't screening them for dementia because for the most part, people are like, this patient seems completely fine. We're going to go ahead and send them home to live by themselves and to carry on with their lives. When they have some significant cognitive decline, maybe they have issues with problem solving, maybe they have some visual spatial issues, some language problems, some problems related to executive functioning. And it's just crazy the amount of patients I see on a daily basis in the hospital who no one screened them whatsoever. And that's another reason. That's the second reason why these patients go undiagnosed, is because there's no one screening these patients. And what does the screening look like? So a screening would just be like somebody does a simple assessment. They go in depth a little bit more than like, why are you here? What's today's date? What brought you into the hospital? What city are we in? Those simple orientation questions I feel like are not enough. And all you have to do is just do a simple assessment, like a clock test, or you can do like you can spend a little bit more time by doing like a MOCA, which is the Montreal Cognitive Assessment. You can do the SLUMS assessment. There's all these simple assessments that you can do that will help you just quickly screen your patient to know if they have any of these deficits. So I don't know, I feel like that's pretty alarming. 60% of patients in the hospital don't show any of these cognitive deficits. So who screens dementia patients? Whose job is it to screen patients with dementia? So I'm going to say, like, first off, any patient that comes in the hospital really should be screened by nursing staff. And I know there's a ton of nursing staff they're just not screening patients with dementia, but there are some hospitals that have some procedures in place. I actually worked at a hospital where any patient that had a stroke was required to do like a clock test. I feel like really every patient should have to do a clock test and also have to go through the orientation questions. And then so it's not just nurses though, like it should also be like the neurologist. The neurologist should be seeing if they have any cognitive deficits. It should also be occupational therapists, speech therapists. So there's all these disciplines that really should be assessing a good chunk of the patients that are in the hospital, and it's not being done. Like, these patients are just going undiagnosed. They're going home. And then their family's like, well, it seems like you have something like there's something definitely wrong with you. What can you do now? I mean, I feel like that's the question, right? Like, what can you do to like help this from, help patients so they don't go home undiagnosed? And as occupational therapists, we cannot diagnose, but we use screening tools that help us to figure out if a patient has mild dementia. And I feel like these screening tools, I mean, they really are diagnostic, but we're not allowed to say that we're diagnosing because we are not physicians. So a simple screening tool for like nursing, for occupational therapists, for physicians, a simple screening tool could be as simple as asking the orientation questions. Where are you? Why are you here? What's your first and last name? What's your birth date? What month is it? What year is it? What city are we in? Those simple questions. And then just ask your patient to draw a clock. See if your patient is able to put all the numbers on it. I usually tell my patients, write on the clock the time 10 past 11, right? That's kind of the simple way that, you're kind of tricking them a little bit, right? The big hand, the little hand, the time on the clock is going to be 10 past 11. Now, some of your younger patients aren't going to be able to do this. Maybe there's some patients from, they just grew up not drawing a clock. That's totally fine. But a clock is just a really simple test that for the most people know how to do it. And then 10 past 11 is probably not going to work for your patients that speak Spanish or another language. You might just say like write 12:15. So simple test, super easy to do. Then you can ask your patient like, what time is it right now? And then I feel like the classic question is always just going through those quick memory questions. Here are 5 words I want you to memorize. And then you go through the 5 words, you have them repeat them to you twice, and then in 5 minutes you see if you can repeat them again. That's pretty much all you need to do. It takes like 4 or 5 minutes to just do this quick cognition screening, and you know if this patient is safe to go home, if they have any cognitive decline, and then, I mean, this is like imperative. If your patient is going to go home or drive themselves home, or they're going to go home and go grocery shopping, and they can't they can't draw a simple clock, like, this is huge. This is so important to be able to assess these patients. Any patient that I think may have some like small, like there might be just something a little bit off about them, I'll just do a quick MoCA assessment, or I'll just ask them a few questions and do a clock test. And if I have more time with them later, I'll do a MoCA assessment. So, and this is for if you work in acute care, if you work in rehab, if you work in a skilled nursing facility, all these facilities, you're gonna need some sort of assessment tool. And as occupational therapists, we're really the only ones that are prepped to go in there and do this, because nursing a lot of times doesn't have the time to do it. The neurologists usually don't have the time to do it either. So it usually comes back on us. And the thing is, like, if you don't do this assessment, a lot of the times these patients, they go home, maybe they follow up with their primary physician. And the thing is, a lot of times the primary physician doesn't do any of these cognitive tests. And there's tons of, there's a lot of doctors that actually, they're told that they're supposed to take people's license away, or if they get diagnosed with some sort of dementia, but it's also based on the state you live in. A lot of these doctors aren't even doing anything, and these patients are continuing to drive, and they're continuing to do their daily activities, which are really unsafe. And I'm not trying to say like these patients shouldn't be doing these things, because I'm all about promoting independence, but there are a huge amount of people on the road that are older that have Alzheimer's dementia, and a lot of them should be tested to see if they're fit to be driving. So, and that if you find that a patient does have cognitive decline, you probably should recommend that they see a physician to test if they have dementia. And then I usually will refer them to like a driver rehab specialist, because all these patients that have dementia really should be seeing someone who specializes in driver rehab to make sure that they're safe to be on the road. So, and even if they don't drive, or maybe they're with family, I think it's really important for family to know if they have these cognitive issues, because they probably shouldn't be cooking or walking away from a stove. And then family just needs to be around them pretty much 24/7. People that have significant cognitive decline, even in some cases mild dementia, they need someone to be around in their house most of the day just to make sure they're safe. So I just wanted to go over this because I think it's super important. There's just 60%, that's a huge amount of patients that are going to the hospital. They have cognitive deficits, and a large, the majority of them are like, they're not being diagnosed with dementia or anything like that. Now, what can we do to help? So the first thing is, use your screening tools, use the MoCA, use the slums test. Also, I would say, like, you want to educate your nursing staff. So if possible, all nursing staff, like, if they notice anything like slightly off about their patients, they should just be going through these questions. They should be doing a quick clock test just to see if this patient is really safe to go home. And the last thing is to establish like a delirium prevention plan. Delirium prevention programs can be carried out by qualified nursing staff to improve sleep, pain medication management, insurance of adequate food and fluid intake, reducing anxiety and disorientation by providing orientation support. Now, this is going to be like having family members, having volunteers, maybe having a sitter in the room just for support. You want to have like maybe a sign in the room, and just every day you want to provide just like a plan throughout the day, what the patient's going to be doing. Structure is huge for patients with cognitive deficits or delirium. And then, educate these patients every day on where they are, what time it is. You want to have availability of personal items. You want to make sure these patients have like their hearing aids. They want to have their glasses. Also, just like training other staff to provide support to these patients. So if you can start establishing like this delirium program, it's just going to help your patients be less confused and be in a more familiar environment. And then you also want to just train nursing staff. You maybe have a sitter in their room. You want to provide structure for these patients. So if you have a sitter in their room and you write everything, like, here's the plan throughout the day. This is when you're getting medication. This is when you're going to be seeing therapy and respiratory and all these other disciplines. Just establishing that structure is so important for these patients. And then also like training other staff, maybe have volunteers spending time with these patients. And then also like family. If you can get family in the room, like that's your number one person to be with the patient, because that's a familiar person, it's a familiar face, and that person can provide support that none of the other staff can provide. So these are just kind of a few things that you can do to kind of prevent delirium or cognitive deficits in your facility, and I think this will make a huge difference in your practice. So I hope you like this video. Definitely like, subscribe, and I'll see you in the next one. Thanks.